Hey, welcome back. This is Nasu with Fight for Kidneys. It has been a while and I'm back again. And today I want to talk to you guys about a few things about kidneys and how you can take care of your kidneys, or mostly if you're in dialysis, the options that you have. I have been there before. I posted about this topic, but I still feel compelled to talk about it more and more. I think the more people hear about it, the more they know that they have choices. For you who is watching for the first time, I'm not a dialysis patient, but I'm a nurse who work in dialysis, that I take care of people who need dialysis to be able to live. So you are probably there, you have heard about dialysis and you are wondering what are your options. Or probably you're already going through dialysis and still you're not aware of what are your other options that you have out there. So why am I compelled to talk about this? I think this is as much I have been doing this for a long time. Working in people with working in dialysis, and I have seen the good part of it. And I'm not here to say that going to an in-center is bad, but I think there are more benefits when you take care of yourself or someone is taking care of you at home. So most people probably are wondering what are the options there. And one thing I also want to talk about is that the technology has improved, has changed how we how people do dialysis. You know, they're making more options for people doing dialysis for people to be able to do dialysis at home. And the options are there. So I'll tag, because I don't work for a particular, I'm not trying to promote any company, but I'll tag, you see the pictures that I have tagged either way to see the options and the machines that are out there. Every day a company is coming out with new technology and they are listening to those people who are doing dialysis at home. For once, somebody posted and they said, how do I open a box? And I posed that question, and the box was about the dialysis supplies. And somebody posted that question because I fought the patient too. I fought the companies that manufactures dialysis products, that manufactures the machines, that provide dialysis care. So all arenas, if you check my platform, I for those companies. I also for the patients in their platform to see what are they experiencing, what are the things that they wish can be changed, what are the difficulties do they have. And this way I follow the patient, because sometimes my own patient might not tell me but something, but if somebody else posts something, then I have opportunity to see there's room for improvement, you know. And I think it's a good thing. For me, it helped me grow as a nurse who take care of dialysis patient, but also help me to see what are people talking about, what are the things that they think they need to be able to give better care to themselves, or be, you know, and to get quality dialysis, if I may say so. So when you are new to dialysis, there are options that you have. You hear that you can do dialysis at a center. That's a clinic you go to. And you also hear that you can do dialysis at home. Or you can do, and then the hours in dialysis in center varies different times. So you can hear people say they do it at night. Yes, those people who work during the day, they are able to go to a center and dialyze at night. Some people also dialyze in the evening, like after, like, you know, it's like a third shift. And so we have the other group that I need to talk about that are doing dialysis at home. So what are the options? What can you do? What can you do? If you're working, you have young children, what are the other options do you have out there? So if you're new, or you are still in center and probably nobody's talking to you about home, please ask about the other options you have. And especially right now, I'm seeing young people who are being diagnosed with kidney failure, that they need dialysis, but they are working, and it's a struggle for them to maintain that work and also go to a center because of the hours. They are given hours that sometimes don't work with their schedule, and it's not because the centers don't want to provide those hours. Sometimes they don't even have that option of those hours. You hear people say, I want to come at 2 o'clock because they work 7 to 3. Some places might not even have that option. Or you hear somebody say, I want to work between 10 and this time because, or between 8 and 10 o'clock, between, some hours that sometimes might not work. Because they have other commitment. They might have to drop kids at school. They might have to pick them after school. So, and most of the time in US, they probably have to pick them at 2 o'clock. They have to be at the pickup at 2 or 3 o'clock. So they look at those hours, and sometimes those hours, depending on when you're diagnosed with kidney failure and how soon you need dialysis, that time might not even work. That's why I'm here to talk to you. When you talk to your doctors, ask them what are the other options. So the best option that I have found is doing dialysis at home. And nobody should tell you that, discourage you. Yes, there's a lot that they have been saying, oh, you can do it at home, or it's complicated, it's not safe. Let me say this. Even when you do dialysis in center, things can change. So just because you're doing it at home doesn't mean your body can, just because you're doing it in center doesn't mean your body cannot get, you cannot get sick. You can get sick. And the few things that happen, whether you're doing it at home or you're doing it at home, in center, is that your blood pressure can drop. You can feel nauseous, and that's because probably your blood pressure is dropping. Probably a lot of fruits are being pulled. You start throwing up. You start cramping. So the main things is cramping, where you have pain on your legs, the blood pressure dropping, that you can just go unconscious, and I don't want to scare you, and where you start getting nauseous and vomiting. Those are the main things that we see. But other things can happen. Same way in center or home, those things can happen. But the good thing is, when you do it at in center, and that's why most people, because they have not tried it anywhere else, they have never tried at home, sometimes they don't even know. So when you do it at in center, you are there for, like most of the places, it's 4 hours. So you are 4 hours and you're putting all this fluid within a short period of time. So there's that shift happening within a short time. So if you do it at home, you do it a little bit longer, and you do it at your convenient time, and you do it multiple times because you have time. People say, oh, I do not have time. Okay. And nobody can tell me you do not have time, because when I calculate how much time people spend on a regular day in a dialysis clinic, it's an average of 8 hours. Or 6 hours. Let me say 6 hours. I said 8 because my things showed 8. 6 hours. So they are there for 6 hours. So it's like 2 hours before and 2 hours later. The time it takes them from the minute they, when they come in, by the time they start, then they go home. So it ranges from 6 hours. And if you don't drive, somebody has to pick you up. Those hours ranges. You can find yourself, you are there for like 2 hours early and 2 hours after your treatment. So that one, it's a lot of time. You have 4 hours that you have just wasted just sitting there. So there are these two options. So you can do the dialysis at home. You can do the one you put the access on your arm. They pull the blood and it goes through the machine and it get cleaned. Then there's the one that you put in your abdomen. That's called peritoneal dialysis. And I'm so excited. There's this company that came up with this machine, and I'll post it there. It's such a small machine. So that's this technology, how it has changed. It's so small. It weighs less than 10 pounds. So 10 pounds is probably like 2 small Bibles. So that's very, very lightweight. The good thing about it, and then the same company has another machine that is also for Hemo, the one that means blood, that you stick needles or you have a catheter and they're putting blood and cleaning the machine. You also waste very less amount, so it's probably like a printer size, so that you can be able to travel with it. So what are the benefits? The benefit of that, it's very convenient to do dialysis at home. It take the time, you spend less time, you're able to be there with your family, so you don't have to incur the cost of driving, the cost of the risk of, like, when you're going home, something happened, your blood pressure drop or something happened and you get in an accident. Not that I'm trying to scare you, but those things happen. People says that the people who do dialysis at home, they take rest medication because they are able to control their blood pressure. Their fluids are controlled because they are doing dialysis a little bit more often. So they don't need a lot of blood pressure medications to be able to control their blood pressure. They also take rest medications to control their phosphorus because their phosphorus is controlled. And one thing about phosphorus medication, you take so much medication. Every time you are eating something, you have to take these phosphorus medications to be able to buy that phosphorus in your body, to get rid of it, because if high phosphorus, that may cause your bones to become weak. They also feel better. The recovery time when you do dialysis at home is less. So when I talk to my patients, they say that it takes them 24 hours. So imagine you had dialysis yesterday, you go home, the next day you're still feeling bad, and then it's about time to come back to dialysis. So they take 24 hours for recovery time. Some, like if you do peritoneal dialysis, the recovery time is about 2 hours or less. If you do the hemodialysis, the recovery hours might be 4 or 6 hours. So you feel much better. You don't feel drained like somebody who has gone to in-center and they had that dialysis within a short time and so much was pulled. You also feel you have more energy, your hemoglobin is in control, and also it changes. You have fewer hospitalizations because your body is able to adjust. It's able to feel much better. Your blood pressure is in control. You're not getting that sick, So the times you visit the hospital is less because of your body is able to hemodynamic or to stabilize so fast, unlike when you go to in-center and your body is being pulled, the fluids are being pulled within a short time, and that's short time I'm talking about 4 hours. And sometimes people go, because they are not able to get there on time, so then they might end up having less treatment, and overall you live longer. So your quality of life is better. You don't have to lose that social life because you're like, I have to be in dialysis, so you can be able to have lunch with your friends. And if you have activities, you might not be able to do it if you're doing in-center because the recovery time. So most of the time you tend to sleep more after dialysis. But if you're doing it at home, you're able to recover a little bit longer. So what are the other benefits? You are able to travel. The travel, it's make it so convenient. So you can travel anywhere you want. But and when you do it at home and you travel, so they just send the supplies to where you are going. So you just take your machine, but the other consumables are sent to where you are traveling. You can take them if you're traveling by car, but if you're flying, then they'll drop ship those products to where you are going. If you're in center and decide to travel, then you have to travel within a proximity of a dialysis clinic. So that limits you on how far or where you travel. The other ones, you're not limited. What are the other things? Your quality of life, travel, and enjoy. And the other thing, let's say, talk about young kids, because I'm seeing young people. And I tell people, what you see, that's how you feel. So if you're doing it at the comfort of your home, you have a nice picture, you're watching your own TV, even in center there are TVs, but I need you to look at this way. So if you're doing dialysis at home, you're able to enjoy your own home and feel the comfort at your own home. But if you do it in center, and especially for young people, you see most of the people or some other people are a little bit older, and so you see somebody getting sick or feeling like throwing up, and that just triggers you to feel that because the body acts what you see. Say for instance, for me, and I can speak for me, if I see somebody throwing up, it triggers me to throw up. So, if I see somebody getting sick, it triggers me, make me feel that, especially throwing up. If I see somebody throwing up, being nauseous even before they throw up, I start getting nauseous. I start feeling like throwing up. So if that's what I'm seeing, you see every day when you go to treatment, that's how you're gonna feel. If you feel people who look like, oh, they're older, they and I don't want to say this way, but what you see make you feel that way. So for young people, to me it feels like you feel more at that age. Depression is the other thing. You see people who look depressed, you're also gonna feel depressed, of which in dialysis, and you can watch the other videos, if people in dialysis or whose kidneys are not working, they are more likely to feel depressed. But if you see the person sitting next to is looking depressed, you feel depressed yourself. But if you're doing it at home, there's nothing to say, and you feel much better. It's how you wake up, how positive you look at it. You see somebody who really don't want to be at the clinic, that's how they make you feel. You feel, no, I really also don't want to be here. But when you wake up and say today gonna be a positive day because you're doing it at home, that positivity will go with you. That positivity will carry you through the treatment. The other thing is, when you do it at home, and I tell people this, when you do it at home, if you have, and one other cause of kidney failure is feeling that there's a family history or risk factor, that if you have kidney failure, there's a chance your loved one might have kidney failure, depending if it was through blood pressure or if other things, and you can go back there because I don't want to go back to all the risk factors. But so if you do it at home and your kids see what you're going through, the whole process, then they will be more prone to making sure they take care of themselves. They make sure they control their blood pressure. They make sure they control their diabetes. So, because they don't want to do it. But when they just drop you, they don't even know what you go through. They don't understand. So, that's it. I was here to let you know that's the option. And if you're there and wondering, saying, I want the convenience, there's no convenience of going to in-center. The convenience is when you do it yourself and you do it your home with your loved one, with the ones you care about, the ones who makes you feel bubbly, the ones who make you feel loved, So, and the benefits are way more. So if you're there yet you have not heard about how to do dialysis at home, please talk to your doctor, talk to the providers and ask them, how can I do it at home? And to me, as a nurse, I say, God forbid, if I was to have to do dialysis, I'll choose home dialysis. And my first choice will be peritoneal dialysis because I can do it at home when I'm sleeping and the machine will be working on it, And if that fails, then I'll go to the next options. In-center will be the last options because to me, I feel it's more convenient to do it at home. There are more benefits and I have seen it. And I can tell you, I've seen people who are doing in-center for a long time and I talk to them about doing home. And I'm telling you, it looks like life has been, it's like years have been added in their life. They look more younger, they look more vibrant, they look like they grow, they feel they have it, they feel like they have control of their own life, they feel they have control of their health, and they just feel happy. And one patient came and asked me, why didn't you tell me about home therapy? And I said I wasn't there when you started. So every time I have a new patient, I always push them to see these are the options. Do home therapy, and then if it doesn't work, come to me. I always make sure the in-center, we make you feel welcome, and we'll give you the care you need to our best. But home therapy, that's where you can give yourself the best care. So if you're looking for something else and you don't really know, start with home. Start with home and say you don't want to know any other options. Your first number one options is home. I thank you again. I hope this helps you make choices, and I'll post the pictures there. I'll show you right there, up here, all the options that are out there. And you have any questions, please inbox me or put a comment there. I look at those comments and I can be able to answer you. Also put my email or something, my connections. You really can get in touch with me anyhow you want me to, you would like to. So I wish you all the best. I wish you good life. I wish you long life. And home therapy, you're gonna live longer. Thank you for taking your time and watching this. All right, thanks.